Testing and early detection have always been a key part of Singapore's fight against COVID-19. And as Singapore steps up its COVID-19 testing efforts, close to 200 clinics are now equipped to perform such tests. Right now, only targeted groups get tested, including staff and residents of senior homes, preschool staff, as well as seniors, healthcare workers and older students diagnosed with acute respiratory infection by their GPs.
Moving forward, testing will also be expanded to cover workers with higher risk of exposure to the virus, such as frontline workers supporting COVID-19 operations. Singapore is to ramp up its fight to eradicate COVID-19 by increasing the number of people tested per day from 13,000 to 40,000. To reach that goal, 4 regional screening centres are now operational.
They're at the Old Police Academy, the Float at Marina Bay, Bukit Gombak Sport Hall and Bishan Sport Hall. A 5th centre at the former Sepak Takraw Sport Hall on Bedok North Street 2 is in the pipeline.
These centres support screening requirements for workers in identified sectors such as construction. The centres conduct polymerase chain reaction tests and do not take in walk-in requests for screening.
Other swabbing sites have also been set up in collaboration with private partners to support these efforts, such as the drive-through testing facility at One Farrer Hotel.
Let's get insight from Dr. Hannah Clapham. She's an epidemiologist and mathematical modeler at the Swee Hock School of Public Health at the National University of Singapore. Welcome back. So, Dr. Clapham, it's been said several times before, and National Development Minister Lawrence Wong said it again yesterday, that Singapore will be able to conduct up to 40,000 tests a day. Will that bring a change in testing strategy, though? Currently, we're doing about 13,000 tests a day, and they're still only targeted at certain groups.
Yeah, so the ramp up of testing is absolutely vital in the response, and moving up to 40,000 tests a day will be great. As we know, Singapore population is 5 million, so we're still quite a long way from the full population. Of course, that's not what we would expect to have happening here. But with 40,000 tests, we're still going to be in a targeted strategy, but of course we'll be able to do more tests. So what we'll see moving forward, I would think, is that we'll see as more sections are opening up, those will be the sections that we will start to see targeting. We saw that with the first lot of schools that were opened up, we saw testing targeted there, and then we'll see in the different levels of schools opening up testing targeting there and moving forward. One of the really important things that I think in testing that will be coming in and will ramp up is going to be testing of people not in those targeted populations, but people with mild symptoms. And I think getting at these parts of the population and these individuals and their role in transmission so that we're able to contact trace from those people is going to be really important. And that's part of the plan. That will the testing of people with mild symptoms will be slowly ramping up in different groups, and I'm looking forward to that.
Some people have asked, Doctor, if everyone should be tested so that we could pick up all the asymptomatic cases. Would that work?
Yeah, so this is a strategy that has been tried. I think we know that in Wuhan this was done recently. So again, with 40,000 tests a day, it would take a long time to get through the Singaporean population. So at the moment, a targeted strategy is the best way forward. I think even if we could do the whole population in a short space of time, it would sort of depend how long that could take. We would have to think carefully about whether that was the optimal strategy, or whether it would be better to maintain targeting on the important populations. And the targeting there is important because we're looking at individuals that are either going to be in situations where they could be spreading to people. So that's why we're testing people that are heading back to work and those kind of things, and also groups that might be spreading to lots of people. So that's an important part. The other part is, of course, people that might be spreading to, or people that are in those high risk groups where we really want to pick up infections early so that we're able to ensure that there is not large amounts of spread through to people, the elderly and people at higher risk of severe disease.
Well, more testing will of course reveal more infections, and ever since we exited the circuit breaker, the number of community infections has gone up, both linked and unlinked cases. Do you see anything in the figures that could derail us from going into phase 2 at the end of this month?
Yeah, this is the million dollar question. So as you say, there's more testing going on, so we're finding more cases. Before, an important strategy or sort of metric that was being used was the ratio of linked to unlinked cases, but that's also going to be changing as we're changing the way that we're finding people to test or targeting those testing. So it's going to be a ongoing thing, and I think just one day's testing isn't going to give us that picture. It's sort of looking at what's happening over a week, bearing in mind the tests that are being done and the number of tests that are being found, number of positive tests that are being found, of course. And it's not just the number of tests, as we've said, it's where those tests are being done. So unfortunately, lots of things to think about, and I know that the task force is looking at these numbers very carefully and keeping track of what they mean for transmission.
Right. Dr. Clapham, I just want to veer to another issue right here. A survey by the Deep Knowledge Group has said that Singapore is the 4th safest place to live in during the pandemic. That's ahead of countries like New Zealand, Taiwan and Vietnam, who have been lauded in their battle against COVID-19. Do you agree with the survey? I mean, after all, New Zealand has removed all its internal measures.
Yeah, so I was really interested to see this survey this morning, and I had a look through the methods that they're using in the survey, and it's an interesting mix of sort of lots of different things that are going into the response and the current situation in the country. So I think the top 20 seems really to me to encapsulate the countries that are doing well in the response. Of course, there are others further down the list as well. And what we have to remember when we're comparing countries is that every country is in a slightly different situation in terms of when the epidemic started, what the population is in their country, the demographics, all those kind of things. So within that top 20, we're seeing a group of countries, as you say, some that are now at very low, if not no cases reported in the countries, and others that have more cases, but they're all including countries that have a really good response and are really also reacting very quickly and well to what is going on within their country. So an interesting metric, and one that we'll keep an eye on, I think, in the coming weeks and months, and it will be interesting to see what happens.
Right. Well, thank you so much, Dr. Clapham. Good to have you on the show again. We've been speaking to Dr. Hannah Clapham from the Swee Hock School of Public Health at NUS.